Hey everybody, welcome to my presentation on the effectiveness of a Pica Box on the frequency of Pica behavior in an adolescent with autism. My name's Adolescent Fox. I go by Ellie. Let's jump into it by getting on the same page about what Pica is. Pica is the ingestion of non-edible, non-nutritive, inappropriate items or substances. It can be harmful or harmless depending on what the item being ingested is. Harmful situations to the extreme look like swallowing a sharp object and it punctures internal organs. Swallowing an item and choking on it, or ingesting a harmful, poisonous, toxic substance potentially could lead to death. With that being said, that is why it is important to try to decrease the Pica behavior and replace it with something more functional. So for this study, I examined the question, will the presentation of a Pica box full of preferred edible alternatives decrease the frequency of Pica behavior for Oliver in the clinic setting? Oliver is my only participant. He's an 8-year-old male with autism and Pica. The study took place specifically in a clinic, 8 a.m. to 3 p.m. Monday through Friday. Frequency was being collected for Pica during that time, every day that the study was conducted. We compared the effectiveness of a Pica box to decrease Pica behavior to just baseline of no intervention to determine if there was a controlling effect of the Pica box over the Pica behavior. Frequency counts were collected during 2 baseline phases, 2 intervention phases. We'll get more into that when we talk about the method. The history of the Pica box. The Pica box is essentially just a fishing tackle box with as many compartments in it as you need for the individual that you are implementing the intervention with. For Oliver, I used 16 compartments full of his highest preferred edible reinforcing items. This looked like chewing gums, candy corn, M&Ms, Skittles, all of his favorite things. This was introduced by Mike Wilson in 1995, and ever since then, it has been adapted for individual use for clients all over the world. It is the least restrictive measure for a Pica intervention. Most are punishment procedures, and so I like this one because it's least restrictive and not very intrusive when it comes to decreasing that Pica behavior. It is recommended to do an ABAB design to monitor the controlling effects of the Pica box, which is what I did. Going over into the method, I used an ABAB withdrawal design, which means during the first and third phase, we collected baseline data, no intervention whatsoever, just collecting the frequency count. During the second and fourth phases, we implemented the intervention of introducing the Pica box. With this study, the dependent variable was the frequency of Pica behavior, so we were collecting a count on that throughout all sessions. Independent variable was the presentation of the Pica box. To give you an idea of what this looked like, if Oliver engaged in Pica behavior during intervention phases, we had a Pica box that we introduced and we were like, hey, how about one of these instead? He got to pick what item he wanted. He would trade us the inedible item that he had for his higher reinforcing edible item from the Pica box. And the goal was to see if that would decrease the Pica behavior, having access to more highly preferred items. So baseline was collected for 3 days, each baseline phase, no intervention whatsoever. We only intervened if it was dangerous to the learner. In intervention, I explained how that worked with the Pica box presentation. Ask if he wants to trade it out. 5 days per intervention phase for both intervention phases. Going into discussion and results, Pica ranged from 37 to 48 in the first baseline phase. And then with the first introduction of the Pica box, it ranged from 18 to 29 counts per day. And then going back into baseline where we withdrew that intervention of the Pica box, the frequency of Pica ranged from 43 to 47. So you can already see that there's an increase in baseline. And then with the intervention, there's a decrease. And then in that second intervention phase where we reintroduced the Pica box, it ranged from 17 to 30 for that frequency of Pica behavior for Oliver. You can see the decreasing trends as the Pica box affects the behavior. Results show that the intervention did decrease Oliver's Pica behavior as we replaced it with eating or chewing appropriate edible items that were very highly preferred for Oliver specifically. Potential limitations that I was worried about going into this study or that we saw during this study were dietary restrictions. If you're working with a learner that has dietary restrictions, it may be harder to fill up a Pica box full of edible items that they can have access to throughout the days. Caregiver restrictions, if their caregivers place a cap on how many items they can have per day, like 5 M&Ms per day, or like only chew 2 pieces of gum per day, or anything like that, it could potentially interfere with the study. The biggest limitation that I personally saw was that one-on-one observation is required with constant supervision necessary to track those high rates of behaviors. Especially in baseline, it's very important that the learner is being observed throughout the whole session. It's very hard to take a bathroom break or anything like that without having to thoroughly explain to someone stepping in for you for those 2 minutes. This is what you're looking for, and this is how we work with it. So lots of training is required, which leads me into future considerations. The monetary requirements, you have to pay for a tackle box, you have to pay for everything that goes in it. And if your learner is going through candy corn very quickly, you're constantly refilling the Pica Box. So just be conscious of that monetary requirement. Personnel and training requirements. As I mentioned, I was the only person conducting this study. I had a BCBA that kind of oversaw me because it's her client specifically. So she knew about it. I was the only one collecting the data, running the intervention, seeing what was happening with it. So as far as personnel and training requirements, it's very important that everyone be trained on the procedure to make sure that there's fidelity with how data is collected and that the intervention is being run correctly, which leads into generalization as a future consideration, training caregivers to do it so that you can generalize it into the home setting, other family members that could potentially work with the client so that it can go into their homes or just into the community. And then always consider the ability or inability to transport your Pica Box into the community setting. When I'm in a clinic setting, it's very easy to carry this box around with me so that it's always with my learner. It'd be pretty easy in the home setting, I think, to have that with you, but is it feasible to take that into the community and see the effectiveness of it there? If I were to continue this study, I would want to train Oliver's caregivers on how to implement this intervention so that they could do it in the home. And I would love to see the effects of it in the home if the functional relation carries over into other settings. But yeah, that is my presentation on the effectiveness of a Pica Box. It did prove to be effective as it decreased that Pica behavior, having preferred edible items as an alternative to the items that Oliver was trying to ingest. If you have any questions, if you want to discuss anything, if you have any ideas, let me know. I'm always open to a discussion. And yeah, that's my presentation. Thank you guys for watching.